segment where I would like to invite a fellow colleague from Dandy TMA, Mancho, to lead this segment. The stage is yours.
Thank you. Hello again, everyone. I'm Manchom. I'm a medical student at Phyllis Medical Academy, and I'm member of the NTTMA, like presenting and research group. Today, it was a great honor for me, honestly, to be a part of this everything, and today it was a great honor for me because this is very such a representative, so such an interesting and very important field. And also, I would like to invite our esteemed psychiatrist, Dr. Alalade, to discuss the self-diagnosis among medical students. This issue we choose because it's important and it's very crucial among medical students, but not only the medical students, but only also people of all ages. And understanding this phenomenon will help us better understand why and how this happens. Doctor, first of all, thank you to accepting our humble invitation today. And please introduce yourself.
Yeah, thank you very much. I'm Dr. Oluwasikemi Alalade. I'm a consultant psychiatrist from Nigeria. I deal with management of all various psychiatric illnesses and mental health challenges in people of all age groups, but with specific interests in children and adolescents. So it's good to be here. I want to appreciate the leadership of the organization for giving me this opportunity to be here today. Thank you.
And could you tell us what contributes to the factors, especially to self-diagnosed students like ADHD, OCD, depression, and anxiety? Could you tell us like what contributes to this condition to self-diagnose among medical students?
Okay, thank you. So I would like to start by saying that being medical students is a very interesting aspect of the lives of everybody. So there is, as once you start medical school, there is you are open to learning all forms of diseases, all forms of syndromes, all forms of illnesses that could an individual could have. So at the initial phase, there's this initial thing of excitement to learn about a lot of all these things. A lot of things that you are not aware about. There's an excitement to learn something new. So in the process of learning something new, usually the ways that all of these things come to play in the mind of the medical students are, the first thing is a medical student is trying to look for, how can I put this thing to my head, how can I understand this illness, how can I understand this syndrome. So in the process of trying to look at all of that, there is a form of internalizing that comes with some of these illnesses. You have just been to class, you have just been to a psychiatry lecture, and you have been taught about ADHD. So you have learned about, okay, the fact that somebody with ADHD, they cannot sit still in one place, they are not able to focus, they can't focus their attention on one thing, they are forgetting things easily and all of that. So in the process of trying to internalize, a student just discovers that, oh, I'm trying to learn this thing, it's becoming difficult for me to learn this thing, maybe I have ADHD. So because that knowledge is there, so the first thing is the fact that that knowledge is there. The process of trying to internalize that knowledge is part of the things that makes it easy for medical students to just jump into conclusion and say, okay, maybe I have this. Then another thing is that we are trying, sometimes the students are trying to use it as an excuse. The Dr. Afra already mentioned something about burnout. So sometimes when students are experiencing some of these burnouts, the knowledge of these conditions can also be an excuse for them to explain whatever it is that they are going through. So maybe I'm reading a particular topic that I'm not really interested in. Let's say, for example, when I was in medical school, I really did not like GIT anatomy. So maybe because now I'm faced with GIT anatomy, I don't like it, I'm not interested in reading it. Because of that, I can just simply say, maybe I'm having anxiety disorder about this thing. So it's just some another way in which the students are trying to use it as an escape route to explain whatever it is that they are going through. Whereas if they actually seek help for whatever it is that they are going through, they may actually know that that is not what they are going through. So to summarize, I would just say that the things that the factors that contribute to tendencies, the excitement of learning something new, trying to internalize what they have read, trying to make it as an excuse for whatever it is that they may be going through. Thank you.
Thank you, Doctor. Yes, that explains a lot, and that makes sense. Because with the prevalence of like online symptom checkers and social media, we know that everything is going on. Like, how can a student or medical student, how can distinguish between legitimate symptoms and misinformations? And what are the actual risks of relying on self-diagnosis? If you could tell us about this.
So, as medical students, we have one advantage, which is the fact that we know where the facts are. You know the textbooks that you are using, you know the websites that you are getting a lot of your lecture notes from. I don't know how lectures are being done in your school over there, but here in Nigeria, there are specific textbooks that medical students are recommended to go through. So you already know that those are fact checked sources for you to get your information from. So you won't just go online and check whatever it is that Wikipedia has to offer you, or what somebody's social media account has to offer you, because a lot of people just come and put things online anyhow they want it. But as medical students, you should know the pages that you can go to, which are generally people, your textbooks that have been presented to you, they are there to be able to give you a list of how these symptoms are actually supposed to look like. Then we have some other things like WebMD Medscape that could help you. But the thing is that there is always a risk about self-diagnosis. There's an adage that says that when you hear hoof beats, hoof beats is when a horse is when you are riding a horse, you hear the hoof beats. That when you hear hoof beats, think about horse, don't think about zebra. So a lot of times the risk of relying on self-diagnosis is that, but because you're a medical student and you have learned a lot of things, when you start having headache, you should think about it as headache, not and look at it in the simplest form that it can be. Could it be a symptom of stress? For us here in Nigeria, where malaria is very common, you could say, could it be a symptom of malaria? Not that because you have a headache, the next thing you're thinking about is brain tumor. And trust me, if you go to Google and you type, I have headache, what could be wrong with me? The first set of diagnoses you may see may be things like brain tumor, pituitary adenoma. All of those things may come up because those are the big things that people want to see. So Google has been programmed to also know those big things that people want to see. So we should shy away from self-diagnosis, shy away from even trying to use social media to make a diagnosis of whatever it is. Because also, as we keep learning to as medical students, we would also be able to understand that headache as a symptom can be a symptom of several illnesses, both medical and psychiatric illnesses. So that is why it's essential that self-diagnosis should be shunned. You should always seek the appropriate diagnosis so that you will be able to know, this headache that I have, what does it signify? Someone with depression can have headache. Someone with brain tumor can have headache. Someone that has someone with, even if you're first, I can see some of us are wearing eyeglasses. If at a point the lens of the eyeglasses becomes weak, you can start having headache. So we're still talking about headache. So with that is why you cannot just go and look for, okay, this is headache. You need a professional to be able to put together what are the other things surrounding this headache to be able to give you the appropriate diagnosis, not social media, please.
Thank you, doctor. And also, I was wondering, these psychiatric issues are these psychiatric issues among medical students and professionals common, and when students should really seek professional help for alarm signs that may indicate these serious issues.
Okay, yes, psychiatric issues are common among medical professionals and students. So, because we are students, because we are medical students, because we are medical professionals, we are not excused from all of these illnesses. It's not a rubber stamp that because of that we can't have all of this. The first speaker has talked about the conditions of anxiety, depression that medical students can have based on the things that they are going through. Even in terms of this self-diagnosis, because of self-diagnosis, medical students are also prone to conditions like somatization, in which you are what you have learned, because you have learned it, you start feeling that you have it, and before you know it, you start having some vague symptoms that seems like you are having that illness. So a lot of the and then sometimes too, because we are medical students are having some challenges in school, they don't know how to communicate these challenges. Before they know it, they start experiencing physical symptoms. So when we talk about somatization, that is expression of psychological symptoms for an illness that is actually physical. So, and it's because they don't really know, expressing physical symptoms rather for an illness that is psychological. So, let's say someone is experiencing burnout. I'm already tired of school. I wish I can just have 2 weeks of break. But you are in the heat of your semester. You can't have a break. And before you know it, already experiencing headache, not being able to sleep. So those are physical symptoms now coming into manifestation. Whereas what that individual is experiencing is actually something psychological. So there is no, as medical students, as medical professionals, we should not shy away from having therapists. Therapies are very good for everybody. There are times that you just, therapy does not necessarily mean that you may not necessarily have any illness that you are experiencing, you may not necessarily have any major thing that you are going through, but just really somebody to listen to a lot of the things that you might be going through. It's common saying that when a problem shared is half solved. So sometimes it may even be one of your colleagues that may just have been that, oh, I also experienced this one time before and this was how I managed it, and you get your nugget on how you are going to handle that. So we should always not shy away from speaking to others. We should not shy away from seeking help. When you have tried something, as medical students, one of the things that you should know is you should know yourself. How do I study? How do I learn? What are my strengths? So a lot, those are all of the things that you are supposed to know that can make the journey of medical school easy for you, because journey of medical school may not be that easy, but when you know yourself, when it now seems as if those things that you seem to know are no longer working, speak out and get help.
Thank you, Doctor, about this. And also, you highlighted the challenges that have medical students. I wanted to ask and talk about stress level, and how do you think what this stress level influence students' likelihood to self-diagnose or misinterpret their symptoms? What does this stress level actually play a role in this? If you could tell us.
Okay, so like I said earlier, when a student is experiencing something that the student no longer understands, oh, I'm somebody that when I read, before I know it, I already understand what I'm reading. But now there's a lot to read, there's a lot to accommodate in the brain, and then stress comes up. And then before you know it, the individual is already making a diagnosis of, oh, maybe I have ADHD. That's why I'm not able to put all of these things in my brain anymore. Or maybe I have depression. That is why it seems as if my concentration is low and I can no longer remember the things that I'm reading. So that stress has already pushed an individual. Like I mentioned at the beginning, those factors. One of the factors I said was that a student is trying to look for a way to explain what they are going through. So they're actually going through stress. So a way to explain what they are going through is by just let me just look for a diagnosis that would explain what I'm going through. And because that diagnosis has a way of making them feel like, okay, this is what I have. You don't need to beat yourself hard. It's because you have depression. That is why all of these things are happening to you. So there's a way it works on the psyche and makes that student feel kind of relaxed a bit. But it doesn't work that way because, like this question has said, it can, before worsening conditions like depression or anxiety, it can actually be a predisposing factor to a student getting anxiety disorder or being depressed. So before we talk about worsening, it could actually be a predisposing factor that, based on that, by the time the stress has come all over and over, an individual may develop depression or anxiety. And for those who have been exposed to it before, or those who have been predisposed to it right before getting to medical school, yes, it can now worsen those conditions in such people.
Thank you, doctor. And if you let me, I would ask you one last question. It was about the benefits, actual benefits. And how do you think, what are the benefits of risk associated with self-diagnosis, and how can you improve the health awareness?
Okay, so from everything that has been said, I want to believe that listeners have been able to identify that self-diagnosis does very little to helping you in understanding whatever it is that you are going through. Because even we as doctors, for myself as a psychiatrist, sometimes I feel somehow I won't sit down and start thinking of how I'm going to make a diagnosis of what is happening to me. I will still want to speak with someone because sometimes some of the knowledge that you have. Okay, so let's say, for example, it's easier to make a diagnosis of appendicitis in a non-medical person than to make a diagnosis in a medical person. I learned that way early when I started my medical career. And that is because for some of us that are in the clinical year, maybe we may understand that, okay, the pain of appendicitis starts from the right iliac fossa before it becomes generalized. But somebody that is not in the medical field is not putting anything to it, is open to all of those things, and the person comes to the hospital and is able to explain to the doctor that, no, doctor, this was how it started from my right here, it started from this place, he's pointing to the exact place, and before I knew it, it became everywhere. But for somebody that is a medical student, you may start looking at it that, oh no, it started from the right iliac fossa, then he moved to the left, then he moved to the epigastrium, then he moved to, and before you know it, because of all of that idea of I know all the abdominal regions, it becomes difficult for even for the doctor to be able to make a quick assessment that, okay, this is most likely what is wrong. So we need to be able to know that is we should not think which is not something that be we should think about too much. Yes, of course, when we start having symptoms, some diagnoses will flip through our mind, but the major thing is that for a good overall well-being of the students, you should go for appropriate diagnosis with the appropriate professionals.
Thank you, doctor, so much for your time and for your attention.
Thank you very much, Dr. Oluwasikemi Alalade, for your wonderful and amazing contributions today. And also, I would like to thank Mancho for her moderation and highlighting these questions. Yet again, the stage is back to the audience. You all can raise your hands or raise those questions in the chat box, and we would select some questions and make the or request the doctor to talk on it. So until the audience are preparing their questions, Doctor, I personally have a question to ask you, if you don't mind answering it. So I am normally someone who's very competitive and who claims to be someone who likes to learn a lot of things. So now that I am very involved in social media and on YouTube, I encounter various fields, topics from various fields. So normally I feel quite overwhelmed because the abundance of information, not only when it comes to medicine, specifically in other fields. And I feel that specifically when I look at, I don't know, someone from business or someone deep in the medical system, that they have so much more knowledge compared to me. I feel that I am lagging behind in that manner. That makes me quite anxious. Like, what would you deal with this? How would you go about uh, mitigating this anxiousness?
Okay, so thank you for that question. So the one thing I would like you to know is that for every individual, there is something that is called jack of all trades, master of none. So for those that may not understand what that means, it means that you know almost everything, you know bits of everything. But when we are trying to look for your expertise, we can't fit you into anything. So that is who they call jack of all trades, master of none. So you should know that as an individual, what you should strive for is being what is my strength, what can I be a master of. You should know as an individual that you are not going to be able to understand everything. You are not going to be the go-to person when every topic of discussion comes, but you know you should have the things that when they talk about this thing, my name must come up as somebody who is an expert in this field. That is what that distinguishes you better. So you should not be anxious about the fact that you don't know everything. You should be concerned about the fact that, okay, this area that I have put as, like for me now as a psychiatrist, when they are talking about mental illnesses, I want to be a go-to person for people to call when they look at all the doctors in the various fields. When they talk about mental health, you as a me as a psychiatrist, I should have been able to distinguish myself that I'm different. I know what I'm talking about in this field. When it comes to obstetrics, I may not be able to give you much, but when it comes to psychiatry, I would be able to give you. And that is a better way that even distinguishes you as compared to trying to learn everything that you are now no longer able to own any other field as your area of expertise. I hope that helps you out.
Thank you very much, psychiatrist, for those valuable insights. And I think we have a question in the chat box. Uh, a fellow audience member asked, how valid is informed self-diagnosis? Like, for example, symptoms aligning with the DSM-5.
Okay, so particularly in psychiatry, you it's not very easy because you know in psychiatry where the problem is from the brain. So whatever problems the individual is having is from the brain, either from any of the lobes of the brain. So it's not even very easy for someone to make self-diagnosis in psychiatry because it's psychiatry diagnoses are mostly made by observations. If you look at what is in DSM, it tries to describe the characteristics of an individual. A lot of people, for many of us here, if you are asked to describe yourself, everybody will say I'm kind, I'm lovely, I'm generous. But if we ask your sibling or we ask your friends to describe you, they may be the ones to be able to tell us that this person is not nice, he doesn't like to share. But for you, if you go somewhere and they ask you to introduce yourself, you will definitely say all the nice things about yourself. And you know, because psychiatric diagnoses are looking at an individual's behavior, it's not very easy for someone to be able to make self-diagnosis because it is other people who are observing you that can say these are the things that we have observed, these are the changes we have observed in you over the past few weeks. So it's not very easy to say you want to, it's not reliable. Let me just say it's not reliable to self-diagnose a psychiatric illness.
Thank you very much for those valuable insights. Until other audience members propose their questions, we have some questions that were requested of us when it came to social media forms, and I would like to get your insights on some of them. Is there any day-to-day mind exercises or tricks that we could include in our daily routine to balance our mental health? Like any wisdom from your point of view? We'll conclude
Ye-
with that question. Thank
Yes.
you.
So two things. Number one is meditation. So for those of us that do yoga, meditation. It's something very valuable that you can do to help to relieve a lot of stress. It helps to clear the head, because when you are meditating, you try to make sure that you don't think about anything. That stressful activity is not what you are thinking about. You're rather thinking about something that brings you joy, something that makes you feel better. So meditation in yoga activities. Then there's another one that we call breathing exercises. So I don't know if some of us have heard about breathing exercises before. So what breathing exercises does is an inhaling and exhaling mode of exercise. So you look for a good sitting position, you close your eyes, then you inhale, you breathe in, hold your breath for like 5 to 10 seconds, depending on how far you can go, and then you exhale, you bring out the air. So you just hold your breath and exhale. So by the time people, it's something that works well for me, works well for a lot of my clients that I've tried it on. So by the time you do it for like 5 times, it's a very good exercise that also clears the head.
Thank you very much, Doctor, for all those wonderful insights. Due to time constraints, we would like to cut short our questions for right now. If the audience members have more questions, we might either answer them at the end of the webinar or post the key insights through our social platforms. So yet again, I would like to take a moment to thank Doctor from all the way from Nigeria to contribute deeply in today's webinar.